We are located at the Kapayam Point off Jalan Pintas. This is the way going towards Dongangon. Or an easy landmark is Plaza 333, and we are right opposite. As a Sabahan, I'm always proud of our beautiful scenery. And this view of the beautiful Mount Kinabalu is just outside our IVF lab. I took this during one of the very early mornings before we started our cases. Sabah Fertility Center is a private fertility center or IVF center. What do we do exactly in a fertility center? Put it simply, we help couples to conceive. 我们的助孕中心提供的服务是帮助不孕的夫妇怀孕。And infertility is becoming more and more common. 1 in 6 couples. 每6对夫妻当中会有1对面对不孕的问题。Of course, we can help these couples by using the very simple treatment all the way to the more sophisticated ones. And IVF is the most advanced among all these fertility treatments, and which also has the highest success rate. What is IVF, or commonly called test tube baby? 试管婴儿. Is it really baby in a test tube? Let's find out. But before that, let me explain how a natural pregnancy occurs. This is a picture of a woman's uterus. And firstly, we need the husbands to have very healthy and active sperms. So the sperms can swim all the way up the uterus, down the fallopian tube to look for the egg. So if the sperm can fertilize the egg, an embryo is formed. And when the embryo is developing, it will travel back down to the uterus, and if it can stick well to the uterus wall, a pregnancy occurs. Sounds very easy, but for some couples who have some problems, for example, the husband has very few sperms and very weak sperms, which can't make it to their final destination, or when both tubes are blocked, so the sperm and the eggs can't meet each other, and this couple, they cannot get pregnant the natural way. And we have to help them with the treatment of IVF. And of course, before a patient decides to go for IVF, they must seek proper consultation from a fertility specialist. So, see a doctor first, and do some blood tests, and we'll start them on hormone injections which will help the eggs to grow. And we need to do ultrasound monitoring to monitor the growth of the eggs. And when the eggs are ready, we will do a procedure called egg pickup to pick up the eggs. So this is how we do the procedure. We will take out the fluid which contains the eggs, and we will check the fluid and see whether we can find any eggs. And this procedure is usually done in the operation room. This is a view of our operating room. It's done under very mild anesthesia, and you can call it a daycare procedure, which means after we finish the procedure, the patient rests for about an hour and they can go home. So they don't need to stay in the hospital, stay overnight in the ward. This is the egg pickup procedure ongoing, and normally we do it under ultrasound guidance. And after we've obtained the fluid, we will pass it to the scientists to check whether we can find any eggs inside. Some patients ask me, Doctor, am I doing IVF or am I doing ICSI? What is the difference? For a conventional IVF, once we get the egg, for each egg we have to put many healthy sperms next to the egg and let them compete among each other and see which one is the champion. So this is the champion actually, that can enter the egg and fertilize the egg. Roughly about 10 years after IVF was invented, a new technology came along which is called the ICSI. And this new technology allows us to catch one single sperm and inject directly into the egg. So this is called ICSI, or intracytoplasmic sperm injection. And the big difference here is that for a conventional IVF, you still need many healthy sperms, which means IVF still cannot help husbands with very weak sperms and very few sperms. But with ICSI, pregnancy is possible with just one single sperm. That's why ICSI is also called the savior for male problem. And gentlemen in the hall, please take note, the sperm quality is declining day by day. Yes, I must say, nowadays, it is more and more difficult to see really healthy sperms in the lab, which means we are doing more and more ICSI these days rather than the standard IVF. Allow me to do a little bit of public education. So guys, please take note. No smoking, handphone away from your pocket, no tight jeans, no sauna, because sperms really don't like hot temperature. This is how we do ICSI. So on one hand, we have a holder that keeps the egg steady. And here we have an instrument that catches the sperm and inject it directly into the egg. This is part of our lab, and this is how an ICSI machine looks like. So after we injected the egg, it will be put into this incubator, or you can call it an oven, for the fertilized egg to develop slowly into an embryo. This is how an embryo development looks like, from 2 cells to 4 cells, 8 cells, and so on. So after we've obtained a healthy embryo, we will do the embryo transfer, which means we will put the embryo back into the woman's uterus. 胚胎移植. And sometimes I got patients who ask me, Doctor, is it 100% guarantee pregnant? The answer is no. Because after we transfer back the embryo into the uterus, it's really up to the embryo whether it can stick nicely onto the uterus wall. And this is how a 6-day-old embryo looks like, trying to implant onto the uterine wall. Sometimes we are lucky, we get extra embryos, and what do we do with it? We will freeze it in this liquid nitrogen gas tank at this temperature. So 剩余的胚胎我们会提供冷冻胚胎的服务。At our center, we also perform fertility-related surgeries. For example, some husbands, they cannot ejaculate sperms, and we can do the biopsy to retrieve the sperms from the testes. Today, I would also like to share some happy news. So since we started our first case late last year, our first IVF baby has safely arrived in August. And this is the, this is the second baby, and many more to come. See you all very soon. Some are almost due. In October 2018, just last month, The Department of Statistics Malaysia reported that the total fertility rate of Malaysians is declining. If we compare back in 1963, per woman average had 6 children, compared to now 1.9 children. And this is below the replacement level. What it means is the newborn babies are not enough to replace the older population, which means Malaysia is soon going to be like countries like Japan, that we have to face the problem of aging population. 我们会面对人口老化的问题。At our center, our dedicated team of doctors, nurses, and scientists, we hope to be able to complement the ministry effort in tackling this problem of aging population. And we hope to be able to provide high quality care, not only to our Sabahan couples wanting to be parents, and hopefully as well as to the couples outside Sabah. Before I end, I would like to thank YB Datuk again for giving us your precious time. I would like to thank all our team members for their hard work, my team of nurses who always have to work overtime with me. And last but not least, I would like to thank my parents who are here today, my family, relatives, and all my friends and colleagues who are all here to give us their love and support. Thank you all very much.